Hi, it's Dr. Fox, licensed psychologist in the state of Texas. And in this video, we're going to discuss OCPD, Obsessive-Compulsive Personality Disorder, and OCD, which is Obsessive-Compulsive Disorder. And we're going to separate the confusion, right? Because they sound similar, but they're different in so many ways. But also know that they can occur together. And research shows that OCD with and without OCPD are similar in regards to gender distribution and age of onset of obsessive-compulsive symptoms. Now, those with OCD and OCPD were found to be more likely to present with the obsessive-compulsive symptoms, such as hoarding, and have significantly more OCD severity, comorbidity, functional impairment, and poorer insight. So what that means is, when we have the OCPD, the personality component, there's significantly more OCD severity. So a lot of those symptoms of OCD tend to be more severe, can occur with other disorders as well, causes greater socioeconomic dysfunction, functional impairment, and tends to lead to poorer insight. And we know that personality disorders, if you've been watching my channel for a while, that personality disorders, one of those universal impairments is impaired insight. So we're going to break this down and see what it all means and how it relates to BPD, borderline personality disorder. So like, share, and subscribe, and let's get into it. Although obsessive-compulsive personality disorder and OCD have similar names, the clinical manifestations of these disorders are quite different. OCPD is not characterized by intrusive thoughts, images, or urges, or by repetitive behaviors that are performed in response to these thoughts. Instead, it involves an ongoing and maladaptive pattern of excessive perfectionism and rigid control. Now, despite the similarity in names, OCD, obsessive-compulsive disorder, can be easily distinguished from obsessive-compulsive personality disorder, OCPD, by the presence of genuine obsessions and compulsions. So what we're going to do, let's first dive into OCD, tease it apart. Then we'll dive into OCPD, tease it apart. Here we go. OCD includes the presence of obsessions and or compulsions. Obsessions are repetitive thoughts, urges, or images that are unpleasant and undesirable, and they drive the sense of anxiety, depression, or other psychological issues. Now, compulsions are recurrent behaviors or thought processes that an individual is compelled to perform in response to the obsession, or according to rules they came up with that must be applied rigidly to lessen the psychological discomfort. Now, let me give you an example. Let's talk about fear of germs. Now, the obsession is that you can't get it out of your head. You're obsessed with the idea of germs, right? So you wash your hands, you take many showers, cleanliness, get them off, to lessen the anxiety or stress associated with the obsessive thoughts of germs. The behavior, wash, the obsessive thought, germs, okay? Now in OCD, you have an ongoing or intense fear that if you don't tap the doorknob 13 times, for example, bad things will happen. A lot of like superstition, but it's really intense. It's not like a generalized superstition, right? Where you might like crumble up a piece of paper and you're like, okay, if I get this one in the wastebasket, then he or she will text me, right? That's a little different. This is much more intense. It's a very intense superstition that you have to perform, otherwise you experience this intense psychological discomfort. Now, the fear is the obsession because it's uncomfortable and it drives this anxiety, depression, or other psychological discomfort. The compulsion is the behavior you engage in to lessen the anxiety, depression, or psychological discomfort, and that is like touching the doorknob 13 times. That is taking a shower, right? Washing your hands over and over again. Now, importantly, right, in order for something to be a disorder, it has to have socioeconomic dysfunction. It has to impair your functioning. How does OCD do that? You're probably asking yourself. Well, I'm going to tell you. These obsessions and compulsions eat up a lot of your time. They take away from working, school, or relationships. The estimate is that obsessions and compulsions take up more than 1 hour of your day each day. Now, OCD doesn't just stand alone, right? There's always some variability, right? Psychologists, psychiatry, everybody are complicating it. I'm going to simplify it. All right, so there are 3 factors or differentiations that we have to consider when we're looking at OCD, Obsessive-Compulsive Disorder. Now, the first is you can have good or fair insight. This means you recognize that obsessive-compulsive disorder beliefs are definitely or probably not true, or that they may or may not be true. So you've got a little bit of uncertainty, right? Maybe I don't need to wash my hands that much. Maybe I don't need to tap that doorknob 13 times. Now, the next one is that you can have poor insight. This is you think obsessive-compulsive disorder beliefs are probably true and necessary. There's a small degree of doubt as to their validity, though, but it's much smaller in the case that I just mentioned. And then lastly is that you can have absent insight or delusional beliefs. And this is that you are completely convinced that obsessive-compulsive disorder beliefs are true. There is no question that the compulsions are needed to manage the obsession. I have to wash my hands, otherwise I'm going to be filled with germs, overcome by germs, and I won't be able to function. I have to tap that doorknob 13 times, otherwise I'll have a heart attack. Otherwise, I'll lose my job. Otherwise, my significant other will leave me, whatever it may be. So you're probably asking yourself, yeah, but how prevalent is this? Like, how likely is this? Well, in the United States, obsessive-compulsive disorder is estimated at 1.2%, with a prevalence internationally of 1.1% to 1.8%. That is about 12 people out of 1,000. Females are affected at a slightly higher rate than males in adulthood, although males are more commonly affected in childhood. So that's OCD, and I hope that it provided you some conceptualization of what the disorder is. Now we're going to switch gears a little bit, and we're going to talk about OCPD, Obsessive-Compulsive Personality Disorder. Now for OCPD, this is a pattern of preoccupation with orderliness, perfectionism, and control. An example might be that you have to have your desk set up and be maintained in a particular way. And if not, you feel intense anxiety and psychological distress. In OCPD, you're preoccupied with details, rules, lists, order, organization, or schedules to the extent that the whole point of the activity is lost. Your need for perfection interferes with your ability to complete tasks. Like you're unable to complete a project because of your own overly strict standards that are not met. For example, you must start at 8 a.m. and you lose time focusing on those who are late as opposed to getting things done by the people that are present. Also, in OCPD, you're fixated on work and productivity to the exclusion of leisure activities and friendships. This is beyond that economic need, right? You're not working so much because of inflation or because costs are higher or anything like that. It's just you are fixated on work. You must get it done. It must be perfect. These things must be in order and done just right. Next is that you are hyper-focused on what's right and inflexible about matters of morality, ethics, or values. Now, this is not better accounted for, or, it's not something we can put into a cultural context or related to religious beliefs. So it's outside of that, right? Is that you have these black and white splittings, not just in BPD and NPD, right? It's in OCPD as well. It's just a splitting, right? It's either good or bad. It's ethical or unethical. The value is either healthy or unhealthy. There's no in between. Now, next, you are unable to throw out worn out or worthless objects even when they have no sentimental value. What does this sound like? Hoarding, right? And that's a component of OCPD. People often get that confused thinking that it's part of OCD. It's actually part of OCPD. So hoarding, right, is that component of OCPD. Also, you're unwilling to delegate tasks to others unless they agree to do it exactly the way you tell them to do it. And let's think about that. How often are people actually able to do it exactly the way you want them to do it? Can we say never? I think never. Never is good, right? Everybody's got their own way of doing things, even if you write it out specifically. But these folks with OCPD are so rigid that it has to be done this particular way. Another component is that, well, you're cheap with buying things for yourself or others, and money is viewed as something to be hoarded for future tragedies. You have to save it because, that rainy day, that flood is coming any day, so we have to save it. We have to have more. That's what money is. We're going to build it up. We're not going to use it for anything like a trip or anything. It is something that I have to build and keep because that rainy day is coming, that flood is coming. And then lastly is that you have an intense rigidity and stubbornness. Flexibility is not in your vocabulary. It's your way or the highway, this way or no way. Doesn't a lot of this rigidity sound like splitting that we see in other personality disorders? Absolutely. Now, OCPD is one of the most prevalent personality disorders in the general population with an estimated prevalence ranging between 2.1% and 7.9%. Now, even though that prevalence is really high and we went through all of these factors, remember, you don't need all of these issues or concerns to be diagnosed with OCPD. Just a preponderance of them, right? A particular number of these traits. And they have to cause a socioeconomic dysfunction. They have to impair your ability for work, school, relationships, things of that nature, right? It's also possible to have only a few of these. But if they are disruptive enough to your school, work, and relationships, it may classify as OCPD traits. And if it's a little confusing, that's why it's so important to go to a qualified mental health provider who can help you identify it. Because if you can identify it, you can learn those adaptive strategies. Now, as I said earlier, we're going to talk about how BPD relates to all of this, particularly OCD. Now, individuals with OCD and BPD, when compared to those with just OCD, meaning no BPD, those with OCD and BPD were found to have lower education, higher rates of several comorbid psychiatric disorders, and this is what I call complex BPD. They had greater frequency of compulsions involving that interpersonal domains. This is like reassurance seeking and relationship fixations, and an increased severity of depression, anxiety, more behavioral and non-planning impulsivity, and greater cognitive compulsivity. This is that you must think about A, B, and C to feel better. And I think that those along the BPD spectrum, they recognize this once you bring it up. They're like, yeah, I do have to focus on this to this certain degree. I do have to try to get this level of, maybe it's self-punishment, maybe it's their self-shaming, whatever it is, to this certain level. And it has an OCD component, an obsession, followed by a compulsive act, which could be just that cognitive rehearsing, that cognitive thinking. Now, treatment is an option, and it can be very helpful. If comorbid BPD symptoms must be addressed first. And this usually occurs by identifying those core content issues and the surface content issues, because many of those OCD issues are surface issues. Because we have to get to abandonment fears, loneliness, rejection sensitivity. We have to see what's driving these OCD obsessions and compulsions, because to turn them down, we have to get to the root. And that's what's so important. I never said easy. I just said important. So treatment is possible. Positive outcomes are possible. I want to wish you all the best. I hope this provided you some good insight. And please like, share, and subscribe. And thanks a lot. Take care. See you next time. Bye-bye.